So when we start to think about what soft tissue we can do around the pelvis, one, it's important to understand what's going on. So if we look at the bottom of our pelvis, so this is our pelvic floor, as if I were looking up someone's spine, you notice that you have a big space here, right? The majority of your pelvic outlet, which would contain your anus, your vagina, your urethra, right? Or your genitals, basically, whether you're male or female. And then also you have an outlet right in front of the pelvis here, your obturator foramen. So your obturator foramen is right inside your groin here on either side of your pubic bone. This is your pubic bone. Above your pubic bone is where a lot of attachments happen from the abdominal fascia as well as from the organs. So depending on whether you're male or female will depend on what organs attach here, but everybody has some ligaments right here that attach the bladder to the front of the pelvis, as well as your abdominal muscles, your groin muscles, all of them sort of wrap around here. So these are the areas we're going to focus on doing soft tissue to. Most of the time when people think about working on their deep hip rotators with trigger point balls or any sort of soft tissue, they're thinking of doing it more up in the glute muscles or in the back of the pelvis, right about here, sort of where your pocket would be. So I think people have a fairly good idea of how to do this already, but where I want you to start thinking about is things that are lower than that. And that's really going to help to change the amount of space that's available in the pelvis, which has a lot to do with any incontinence problems or gastrointestinal disorders, your breathing function. It's all a game of pressures. So pressure of the pelvis, pressure of the abdomen, pressure of the thorax, pressure of the head. These all have to equal out for our normal bodily functions to occur. And when the pressures are off, bodily functions are off. And then you get this nasty feedback cycle of not feeling great, so the muscles tighten up, increase pressures or decrease pressures, and just this nasty cycle. So beginning to get some soft tissue work and learning how to move these bones is key. So with the soft tissue work, it's really imperative to have a soft ball. You cannot do this type of soft tissue in these sensitive areas with a hard ball. So no baseballs, no racquetballs, no lacrosse balls, no tennis balls, no golf balls. They need to be soft. So I would rather people err on the side of too soft than too hard, because even with the soft balls, having stimulation down in this fascial area is going to increase your sensory information and improve blood flow and just general vascular supply to the area, which helps to improve general function of everything there, the ligaments, the organs, the muscles, etc. So the softer the ball, the better. These balls specifically are Franklin method balls. You can get them on Amazon.com. You can get them on OPTP. You can get them on the Franklin Method website. If you prefer, you can go to the toy store or the pet store and find some alternatives. Though these are my favorites, even after trying to find some other options. So this is a Franklin smooth ball. This is a Franklin texture ball. You notice they're different sizes. So as you're beginning, the bigger size is better than the smaller size. So you're going to take the Franklin ball and you're going to start on the sits bone. So right on the sits bone, and I usually have people sort of roll around the sits bone first just to explore how big of an area it actually is. Then from there, I have people roll back up the side of the pelvis. Okay, so from the back, it's going to look like this. Ball is on the bottom of the sits bone, and then we roll up the side, and we just can do a fan on the glute, just the area that you're already familiar with. Fan that open. And then also focus on the spot in between the sits bones and the tailbone. So you're going to come a little bit posterior and then midline towards the tailbone. This is going to start to be really tender, okay? So just be careful, take your time, and breathe. From there, we're going to then explore right in front of the tailbone towards the perineum body. and a little bit anterior. So exploring the anterior and posterior pelvic floors. We'll work on the other side, same spots. Then we'll flip over and we'll start to explore the superior surface of the pubic bone and into the obturator foramen here. These are both really great spots that don't get a whole lot of attention on either manual therapy or self trigger point therapy, and make a huge change in how comfortable you are seated on your pelvis, and then improving the mobility of your hip joint in order to hip hinge more comfortably.